Depression, also known as major depressive disorder, MDD, is a mental health disorder characterized by persistent feelings of sadness, hopelessness, and a lack of interest in activities that once brought pleasure. It is a common and serious medical condition that affects millions of people worldwide. Symptoms of depression. The symptoms of depression can vary from person to person, but common symptoms include persistent feelings of sadness and hopelessness, feeling sad, empty, or hopeless most of the day, every day. Loss of interest in activities, no longer enjoying activities that once brought pleasure. Changes in appetite and sleep. Changes in appetite or sleep patterns, such as eating too much or too little, or sleeping too much or too little. Fatigue, feeling tired or having a lack of energy. Difficulty concentrating, trouble concentrating or making decisions. Feelings of worthlessness or guilt, feeling worthless, guilty, or helpless. Recurring thoughts of death or suicide. Thoughts of death or suicide. Causes of depression. Depression is a complex condition and there is no single cause. However, some common causes and risk factors include genetics, family history of depression, brain chemistry, imbalance of neurotransmitters such as serotonin and dopamine, hormonal changes, such as those experienced during pregnancy or menopause, life events, traumatic events such as the loss of a loved one or stressful events such as a job change or move, medical conditions, certain medical conditions such as thyroid disorders or chronic pain. Types of depression. There are several types of depression, including major depressive disorder, MDD, the most common type of depression, persistent depressive disorder, PDD, a type of depression that lasts for 2 years or more, postpartum depression, PPD, a type of depression that occurs in women after childbirth, seasonal affective disorder, SAD, a type of depression that occurs during the winter months. Diagnosing depression. Depression can be diagnosed by a mental health professional, such as a psychologist or psychiatrist, through a comprehensive evaluation, including physical exam, to rule out any underlying medical conditions, psychological evaluation, to assess symptoms and mental health, diagnostic criteria, to determine if symptoms meet the diagnostic criteria for depression. Treating depression. Depression can be treated with a combination of medications, antidepressant medications such as selective serotonin reuptake inhibitors, SSRIs, therapy, psychotherapy such as cognitive behavioral therapy, CBT, lifestyle changes, healthy lifestyle habits such as regular exercise, healthy eating, and adequate sleep. Living with depression. Living with depression can be challenging, but there are several strategies that can help. Seeking support. Connecting with friends, family, or a support group. Practicing self-care. Engaging in activities that bring pleasure and relaxation. Staying active. Regular exercise can help manage symptoms. Getting enough sleep. Adequate sleep is essential for managing symptoms. Conclusion. Depression is a serious and common mental health disorder that can have a significant impact on daily life. However, with proper diagnosis and treatment, it is possible to manage symptoms and improve quality of life. If you or someone you know is struggling with depression, it is essential to seek help from a mental health professional.